Dialysis is a medical procedure performed in hospitals or dialysis centers to remove waste, toxins, and excess fluids from the blood when the kidneys are not functioning properly. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Here's how each is done in a hospital setting. Hemodialysis is the most common type of dialysis done in hospitals. The procedure begins with preparation, where a vascular access is established, typically in one of the following ways: an arteriovenous fistula, which is a connection made between an artery and a vein, usually in the arm; an AV graft, which is a synthetic tube connecting an artery and a vein; or a central venous catheter, which provides temporary access via a catheter inserted into a large vein in the neck, chest, or groin. Next is the machine setup, where the patient is connected to a hemodialysis machine using tubes that link the vascular access to the machine. The machine has a dialyzer, also known as an artificial kidney, that filters the blood. During the dialysis process, blood is drawn from the body through the vascular access and passed into the dialyzer. The dialyzer removes waste, toxins, and excess fluid from the blood, and the clean blood is then returned to the body. Monitoring is crucial throughout the procedure, as the patient's blood pressure, heart rate, and other vitals are monitored. Adjustments are made to the flow and composition of the dialysis fluid as needed. Each session typically lasts 3 to 5 hours and is done 3 to 4 times a week. Now, let's discuss peritoneal dialysis, which uses the lining of the patient's abdomen, known as the peritoneum, as a natural filter. The procedure begins with preparation, where a catheter is surgically placed into the abdominal cavity. Then, a sterile solution called dialysate is infused into the abdominal cavity through the catheter. Waste products and excess fluid pass from the blood vessels in the peritoneum into the dialysate. After a set dwell time, which lasts several hours, the used dialysate is drained out through the catheter and replaced with fresh solution. There are two types of peritoneal dialysis: continuous ambulatory peritoneal dialysis, or CAPD, which is done manually several times a day, and automated peritoneal dialysis, or APD, which is done at night using a machine. Supportive measures in hospitals include regular monitoring, where blood tests are done to check levels of waste products, electrolytes, and overall health; dietary counseling, where patients are advised on specific diets to minimize waste buildup; and infection prevention, where strict hygiene protocols are followed to prevent infections at access sites. The advantages of hospital dialysis include being supervised by trained medical staff, having emergency care readily available, and ensuring that equipment is regularly maintained and monitored for precision. If you feel this is a very informative video for you, please press the like button and share this video with your friends. For more informative videos, please subscribe to the Informativity YouTube channel and Facebook page.